Here's another episode of the We'll Just Agree
To disagree.
podcast. I'm Beyonce Fox.
And I am Ryan Lee. Beyonce, we have a special guest
Yes,
today.
we do. And I am so happy to have Dr. Shayna Roselle on the podcast today. We're going to talk about breast cancer awareness because October, of course, is Breast Cancer Awareness Month. And I feel like this is a topic that we all should know more about. You know, we do the walks, we see the parades, we see everybody dressed in pink for the month of October. You know, we're wearing breast cancer awareness gear. But I want to have that same energy. You too. I want to have that same energy throughout the year than we do just in October. Because as a woman, you know, breast cancer is something that we really, really, really need to know about. But we also are learning more and more every year, it seems, that men can get breast cancer too. So, Dr. Roselle, you are an oncologist with Affiliated Oncologists LLC. First of all, tell us what an oncologist is.
Sure. So thank you so much for having me. So basically, an oncologist is a doctor that specializes in treating cancer. So you tend to just go out your path by going to medical school. You get your residency training and become a primary physician or an internist. And then afterwards, you become a specialist. And so my specialty has been taking care of patients that look like me and others who have been affected and afflicted by cancer.
Interesting.
Can you talk about how that is? We were kind of talking off the podcast. How is that job? And before we get into the breast cancer topic, how is that for you? Because, you know, I think we all on this call have lost someone or know someone who's been affected by cancer. How is that to go work on a daily basis and you deal with people that are battling this terrible disease?
I think it's twofold. I think it's difficult, right? I think looking back in hindsight at my training, I never thought I would be an oncologist. You hear the word cancer and you automatically think fear, right? And you say, oh, this person is not going to make it. But the truth is, I look at it as a 70-30, that 70% of the patients actually do very well and are actually survivors. And it's those 30% that, we all remember that we take home about those patients that did make it. So on a good day, I actually have a really good day. And then there are those bad days, just like any other job. For me, I think we need to really have someone who is our advocate and who can help identify. And so there are not many oncologists that look like me. I am a African American woman. And so I represent that 2% of African American doctors, but also those African American doctors who are female. And so with that, I think that I have to do this. This is what my purpose is. It is what my passion is. And so I know that this is why I was brought here on this earth.
Well, thank you for representing us.
Yes,
thank you.
Absolutely. So we're going to get into breast cancer, but first of all, let's just get to the basics. What exactly is cancer? And I'm hearing that, correct me if I'm wrong, doctor, because you know better than I do. I mean, come on, you went to Stanford University, you went to Northwestern University, and you did your residency at the Mayo Clinic. Wow.
Good Lord.
I know. I mean, she's a heavy
hitter. I need to
hitter.
have you on speed dial just to answer random life questions.
She's a heavy hitter.
What do I eat for breakfast today, Doc? Doc, I need some help with life, Lord.
Honestly, so
I'm question.
I graduated with a bachelor's, barely.
Not barely. Anyway, two-part question. First of all, in layman's terms, of course, what is cancer? And is it true that we all have cancer cells in our bodies?
No. So let's first kind of get to the facts. So cancer is just your normal cells that are continually growing. There is nothing that stops them. So everything in life, you have kind of a system. You have brakes. Hey, stop the car. It can't continue to go. You have to stop the car. And similarly, with cells, you don't want the cells to continue to grow. So the body is miraculous in that it says, continue to grow, stop growing. Repair yourself, stop repairing yourself. You cut yourself, heal yourself. Cancer is where there is some form of problem where there is continued growth in your normal cells. And what happens is these cells continue to grow until they take over the body. So it is not necessarily a natural thing. It's something where there is a malfunction of the normal body function.
So we don't, I've been told before that everybody has cancer cells in their body already. So that's false.
That is completely false. You have normal cells, and then something triggers these cells to grow. And what are those things? So, sometimes there are mutations or what we call changes that can happen in the body. And this is what happens with your normal genes, for instance. So, some of my patients, I run also a high risk genetics clinic at Advocate Christ. Some of those patients are born with a gene. So, in every cell, there is a change that says, this is not supposed to work. That doesn't mean you're going to get cancer. It means that you have a higher risk of developing cancer. And what happens is throughout life, some other change happens. So whether there is some environmental factor whether you have been smoking, whether you have been living in a population where you're contaminated, whether you have had exposure to many toxins, that second hit or that second change is what causes cancer.
Hmm. Okay.
I want to take it to breast cancer, with it being Breast Cancer Awareness Month. Can you first speak on the importance of getting an annual checkup?
So I think first, when we talk about the importance of getting an annual checkup, we first really need to talk about why breast cancer is important.
Mhm.
And so we know that breast cancer is one of the number one cancers when we're talking about women. So about in 2023, there are roughly 300,000 new cases of breast cancer. And, although there are 4 million patients who have actually had breast cancer, about 43,000 will actually die. So we know that we're still making a lot of progress with treating these patients. But one thing for certain is that we still need to do better, specifically in African American populations. We know that African American women, as well as men, they're delayed in actually going to the doctor to seek care. And because of that, you have more advanced stages, and you also don't have the same kind of treatment possibilities that you can have for your counterparts. And so, with that being said, what I would first say is that we need to encourage our people to actually go seek care, to seek regular care, to actually go get your mammograms and your screenings.
What age can women and men get mammograms and screenings? Because that's been fluctuating over the years. It seems like it changes. So
Yes.
what is that median age or that beginning age where it's like, okay, I'm this age, I now need to go?
So that varies. And I think, as we learn and, become more educated, that's going to change. That's going to change with everything. You become more apt to learning how to take better care of a car. There's new technology. And that goes also with learning the human body. So before, we said get your mammograms at 45, right? But then we started learning that, hey, breast cancers are occurring earlier in age, or African American women may be predisposed to actually getting more life-threatening types of breast cancer. So now it's 40, but that's not even for everyone. So, for patients that do have these genetic changes, I'm recommending that they actually get tested age 25. And so we know that 7% of these patients have these genes. You may have heard of like the Angelina Jolie effect of having the BRCA mutation, but there are so many other genes that you can actually have. And because of that, we recommend that you get screening earlier. So the first thing I would say is actually have that conversation with your family. Talk to them, get your history. We don't talk about what's affecting us. We don't talk about cancer. If you start talking about that and becoming more knowledgeable, then you become more empowered to take some additional steps.
And how is it that breast cancer affects men? I mean, obviously women have more fatty tissue and we have more prominent breasts than men, but more and more men are getting breast cancer now. I actually know of a man who
Mhm.
recently passed from breast cancer. Uh, Beyonce's father, Matthew Knowles, he's an advocate and an
Yes.
ambassador, if you will, for men with breast cancer. When we go to the walks, I've been doing these walks for many, many years, and it seems like each year more and more men are
Yes.
present at
Yes.
these breast cancer awareness events. So can you just explain how that works?
Yes, absolutely. I think it's, always first the first common misconception is that, men cannot get breast cancer, which I just did a talk a week ago. It is a common misconception. Um, we know that in even this year there are about 2,800 men who have some form of invasive breast cancer. Um, it's not as common as women. So we have 1 in 8 women who will get breast cancer. It's about 1 in 800 men. So not as common, but it is still there. Men still have the same types of anatomy that women have. And so it is still important for them to evaluate themselves and to check themselves. And if they notice some change, to actually seek care. Black men, again, and it's not just breast cancer, it's prostate cancer. Black men have a worse prognosis than even their white men. And so, why is that? Many men are not actually going to the doctors. What I would always say is it's difficult being a Black man, but it's also difficult being a single Black man. And so men, I advise you to get a wife, get a girlfriend, someone who can encourage you to go to the doctors and get some health care.
Trust me, even with being a girlfriend, it still is not.
Wait, can I say I literally had
At all.
a stomach issue like a few months back, and I was not going to the doctor. I was like, ginger ale will fix it. And Kiki, who we work with here, literally a female, booked my doctor's appointment. It was like, you're going to the doctor at this point.
It's real. It's real. We know the data that men who have wives, who have sisters, who have some form of a female counterpart, they do better than single Black men who are alone. And so
why is it though that men specifically, but maybe Black men and women, why do we not want to go to the doctor?
Oh my goodness. That's so, man, you opening up another can of worms. We know there's a lack of trust in the Black community amongst, many things. So we hear of the Tuskegee experimentation. We hear of the story of Henrietta Lacks. All of these kind of play into our lack of trust within, the system within in medicine. I've heard, oh, you just want to get money from me. Or, you're not really here, or you're trying to try some novel medicine or some new research. But I think, to dismantle a lot of those myths, we have to first start finding doctors that look like ourselves. It is hard, I have tons of patients who trust me because, hey, I'm Dr. Shana, I'm Dr. Rose. They like that I look like them, that I can identify with them, that I've known their plight, and so they're more willing to listen. And so if you don't have enough of the pool of African American doctors, you don't have a lot of trust. And so I would encourage, our residents, our students, our young kids who are interested in STEM to go out there to try to reach those goals, to find positive role models, because we need you.
Yeah, that's why I think I was thanking you in the beginning, because when I finally booked the doctor appointment, I too was looking for a doctor that looked like one of us. And it took a long time.
You found one?
I finally found one.
Oh, okay.
Got an email. She then moved, but
well, you go find
I'm gonna have to go find another one.
Oh, okay.
But that's very important to say, because I will say when I went, there was just a sense of a trust of, hey, you look like me, you can talk like me, you can break it down like me. She was kind of explaining some of the things like, I know why you haven't been here. Like, she got it and she understood it. So thank you once again for your services, because we do need more young kids to get into the STEM and medical field.
Absolutely. Dr. Shana, back to the breast cancer piece. I was on a website the other day, because I'm always on websites, and I'm not going to give credence to this one because I don't know if this is factual or not, but there was something stating that self breast exams are no longer necessary. I read that and I was like, wait a minute, hold up, wait, what? Let me get it straight from you.
Yeah, so when you look at the data, so the data says that breast self-examinations do not reduce or do not increase survival. Doing your breast exams do not improve survival. What improves survival is actually getting your mammograms and or your ultrasounds if you have dense breasts regularly. But what I would say and what I encourage my patients is to become familiar with your breast, okay? Because there are a lot of changes that may occur, and that, I may not see you every day, and it may be you who are the first ones to actually notice some change. By the time you're noticing a change, that is already a more advanced stage. So if you're seeking care, that is what is improving survival.
Okay. So you can still do the breast exam self, but it doesn't necessarily mean like, oh, you're good, no need to go get that.
No, No,
Okay.
and it's the reason is because what we want is for you to go to the doctor to get that mammogram and ultrasound before you feel some change.
Got it.
You shouldn't feel a change if you're seeking care with doing your mammograms and your ultrasounds.
Okay.
It should be very tiny.
One last question I want to ask you, just with cancer in general. I've done or you see a lot of research and studies or on the news. There's certain foods not to eat this to try to prevent from getting cancer, and do this and do that. Is there truth to that, or is some of it may just be your genetics?
Ooh, so I think that is also a very complicated question. So, I hear another myth that sugar feeds cancer.
Mhm.
That is a complete myth. What I would say is have a balanced diet, right? Do not be an extremist. I have vegetarians, I have vegans, I have people who are complete naturalists who still get cancer. So
Wow.
that is not the complete
Yes.
Thank
answer. I do believe that cancer is not natural, right? So I don't think that doing natural things is really going to be the complete fix. What I
you.
would say is trying to live a balanced diet, exercising, working out at least what they're saying 30 to 40 minutes, at least 3 times a week. That is what helps. We know that obesity increases your risk of cancer.
Okay.
So if we can lower the rates of obesity that's out here, of course, I think we can make some improvement. Genes is something that you can't change. You're born with those things. You can't change who you were born to. So that puts you at an increased risk. But you can do some things out here in this world that kind of help to decrease that chance.
Absolutely.
That's so interesting because, like you said, there are people who are so healthy. They work out every day. They run marathons. They eat vegetables and fruits,
Yeah.
and they end up with cancer. And then you have people who smoke. They're obese. They're they're
Exactly.
they're healthy, if you will. So that is very interesting how that works. Anything else that you think our audience should know about this thing, breast cancer?
So I would say, again, thank you for having me. But I would love to encourage you all to just make sure you're going to get your mammograms and your ultrasounds. Don't just wait till October. Do it year in, year out. It is important. Making sure that you're an advocate for yourself. If you are worried about something, please bring it to someone, whether it's your doctor, whether it's your pastor, whether it's your fitness instructor. Bring it to someone, to your community, so that someone can pay attention and look for you. Don't think that you can't get breast cancer. What we know is that 93% of patients don't have a family history of breast cancer. It's only 7%. So most people believe that, oh, just because it doesn't run in my family, I can't get it. You can get it. So keep in mind, be proactive, take ownership of your own health care, and let's improve the statistics.
Mhm. Wow, I've learned so much on this podcast, and I think
True.
Beyonce and I both, like, you see, we were asking you questions because we hear so much, and you hear
Yes.
this myth, you don't know what to believe. So thank you for clearing some of these up. And Doc, I'm gonna have you on speed dial just for everything still.
Anytime, I'm available,
Coming
always.
too.
Do you know this woman has a degree from Stanford
That is
and
why I'm
Northwestern
calling
and
her.
did her residency at the Mayo
That is why I'm
Clinic,
calling
Mayo
her.
Clinic
She
in
probably can help me out.
Rochester, New York?
She-
Minnesota.
Minnesota. Do you
She
understand
can help me out
the
financially.
breadth of
She
that
can help me out with so
knowledge?
much problem.
You are amazing, Dr. Shayna.
Yes,
Thank you
yes,
so
So
much
much.
for your time.
yes.
Really appreciate you. And thank you, as Ryan mentioned earlier, thank you for all that you're doing
Yeah.
in the community with the STEM,
Yeah.
being a board member, founding board member
Yes.
of the school and things like that. We really, really appreciate you. And thank
Yes.
you so much for your time and your
Yeah.
knowledge.
Thank you so much for having me.
Of
Dr.
course.
Shayna Roselle, they call you Rose, Dr. Rose.
Dr. Rose, Dr.
See, I
Bob.
like that already. Dr. Rose. We're gonna pour
Yes.
up the rose with the Dr. Rose.
Anyway, Ryan, that's enough. That's
like
enough
this,
right
Doc.
there. She's an oncologist at Affiliated Oncologists LLC. God
Yeah.
bless you. Thank you. Thank you. Thank you for keeping us healthy.
Thank you. You guys have a great day.
You
Too.
too.
Bye-bye.
Bye bye.